Well, hello, I'm here with Dr. Abrams today, and Dr. Abrams happens to be an eye doctor, an ophthalmologist, at least so I think. You'll correct us if that's wrong. But hi, Dr. Abrams.
Hello. Hi, Helmut.
Hi. So, Dr. Abrams, there's lots of people out there who, at least I am, and I think other people also, we're a little bit confused of what's the difference between cataracts and glaucoma? What are the symptoms? Not so much what's the difference between, the little tiny technical and clinical aspects which are happening with the eye, but for us as the patient, what is the thing which makes us realizing we have one or the other? What are the symptoms? What are the difficulties we're experiencing with one or the other? Can you shed some light on that?
Well, cataracts have a direct effect on your vision. When you start to develop a cataract, your vision will immediately start to get worse. On the other hand, glaucoma is a silent disease. In its early stages, it really doesn't have any effect on your vision at all, so that you don't know that you have it until the later part of the disease process, at which time it may be difficult or impossible to get back what you've lost. Cataracts can always be treated with surgery, and you can always get a 100% cure. That's the fundamental difference.
Okay. Now, what type of you notice your vision. You say, it affects your vision, but there are so many aspects of vision. What has happened? Is it getting blurry? Are you getting, tunnel vision? Are you, are you getting nearsighted? Are you getting farsighted? What part of the vision?
A combination of all of those, actually. When a cataract begins to develop in many people, you'll become more nearsighted, which means your close-up vision actually gets better, while your distance vision gets worse. That's a side effect of the cataract forming. But the direct effect of the cataract is that it begins to look like you're looking through waxed paper or a very, very foggy window. And the symptoms get worse when the light is not very good, for example, driving at night. And the symptoms can even get worse in very bright light, like driving toward the sun, or looking at someone who's backlit in a window, standing against a bright window. You may not be able to see them, at least the details of their face, because of the cataract.
Okay.
Glaucoma has very little effect on the vision, as I said, until very late, at which point it just becomes very difficult to see when the light is not perfect.
Becomes difficult to see. So, when the vision gets blurry, it becomes difficult to see. So glaucoma has then the same type of effect, it just becomes blurry and difficult to see?
Well, yes, I think it would be difficult for a patient to really know. When their vision is affected by cataracts, at least early cataracts and glaucoma, it may be very similar. In the later stages of glaucoma, then the vision defect becomes very different. You may lose entirely a portion of the vision above or below where you're looking because of the damage to the nerve.
I see.
For example, a lot of people, will have some difficulty looking at a line of letters because all they see is the top half or the bottom half of the letters. That's what advanced glaucoma would show. In cataracts, the entire letter would be blurry.
Okay. All right. Can glaucoma? You said that cataracts can always be done with surgery and can be prevented. Can glaucoma be prevented with surgery at any given point?
Theoretically, you could prevent glaucoma if you knew that it was going to happen. The problem is we don't have any way of predicting whether it will happen, or if it's there, whether it will get worse. That's as opposed to cataracts, where you can actually observe them occurring. When a person has glaucoma, the best that you can hope for once you've made a diagnosis is to stop any progression. So what is lost in glaucoma, for the most part, cannot be recovered, regardless of what you try and do. But the treatment for glaucoma is really easy. If you take eye drops, you can control the pressure which is causing the damage, and it's very easy to live with glaucoma because all you need to do is use a drop every day. In a very few cases, the drops don't work and you are forced to do something else, but they're the vast minority. Most people with glaucoma can be treated.
Got it. So there's no chance of going blind with glaucoma?
Not if you pay attention to your vision. If you are coming in and getting your eyes checked when your vision is good, then you're being checked for early stages of glaucoma. And if you come in when your vision seems to be affected by something, then you'll at least be caught and treated before your vision gets bad.
Got it. Well, thanks, Dr. Abrams. That I think was hopefully very helpful to people listening to, and I'm sure I'll be back with more interviews with you. Bye-bye.
Bye-bye. Thank you.